Chapter 1: The Theoretical Basis of Cognitive Behavioral Therapy. Cognitive behavioral therapy, CBT, is a therapeutic approach grounded in a combination of cognitive and behavioral theories. Understanding the theoretical basis of CBT is essential to grasp how it works and why it has been so effective across a variety of psychological disorders. This chapter delves into the key concepts that underpin CBT, including the cognitive model, behavioral theory, and the integration of these ideas into a cohesive therapeutic approach. The cognitive model: understanding thoughts, emotions, and behaviors. At the heart of CBT is the cognitive model, which posits that our thoughts, rather than external events, play a crucial role in shaping our emotions and behaviors. This model was primarily developed by Aaron Beck in the 1960s and has since become a cornerstone of cognitive therapy. 1. Core premise of the cognitive model. The cognitive model suggests that psychological distress is often the result of maladaptive or distorted thinking patterns. These thoughts, known as cognitive distortions, can lead to negative emotions and behaviors that reinforce the initial distorted thinking, creating a vicious cycle. For example, a person who frequently thinks, "I am worthless," may experience feelings of depression, which then lead to withdrawal from activities and social interactions, further reinforcing their belief in their worthlessness. 2. Types of cognitive distortions. Cognitive distortions are irrational or exaggerated thought patterns that often occur automatically. Some common types of cognitive distortions include all-or-nothing thinking, viewing situations in black and white terms without recognizing any middle ground. For instance, believing that if you don't achieve perfection, you are a complete failure. Overgeneralization, making broad conclusions based on a single incident or piece of evidence. For example, concluding that you are always unlucky after one negative experience. Catastrophizing, expecting the worst possible outcome in any situation, often blowing things out of proportion. For example, assuming that if you make a mistake at work, you will be fired and unable to find another job. Mental filtering, focusing exclusively on the negative aspects of a situation while ignoring any positive elements. For instance, dwelling on a single criticism while disregarding multiple compliments. Personalization, blaming yourself for events beyond your control or taking responsibility for things that aren't your fault. For example, thinking that a friend's bad mood is entirely due to something you did. 3. Core beliefs and schemas. Underlying cognitive distortions are core beliefs and schemas, deeply held, often unconscious beliefs about oneself, others, and the world. Core beliefs are fundamental assumptions that we hold, such as, "I am unlovable," or "the world is a dangerous place." These beliefs influence how we interpret our experiences and can lead to patterns of thinking that reinforce our negative views. Schemas are broader cognitive frameworks that encompass a collection of related core beliefs. For example, someone with a failure schema might believe that they are destined to fail in all aspects of life, leading them to interpret any setback as evidence of their inherent inadequacy. 4. The cognitive triad. In the context of depression, Aaron Beck identified a pattern of negative thinking known as the cognitive triad. This triad consists of negative views about the self, the world, and the future. Negative view of the self, believing that one is flawed, inadequate, or unworthy. Negative view of the world, perceiving the world as hostile, unfair, or full of obstacles. Negative view of the future, expecting that life will continue to be difficult and that things will not improve. These negative views reinforce each other, creating a cycle of depression that can be difficult to break without intervention. Behavioral theory: the role of conditioning in behavior. While the cognitive model focuses on thoughts, behavioral theory emphasizes the role of learning and conditioning in shaping behavior. Behavioral theory, which has its roots in the work of psychologists such as Ivan Pavlov, John Watson, and B.F. Skinner, provides the second pillar of CBT. 1. Classical conditioning. Classical conditioning, first demonstrated by Ivan Pavlov, involves learning through association. Pavlov's experiments with dogs showed that a neutral stimulus, such as a bell, could become associated with an unconditioned stimulus, such as food, to produce a conditioned response, such as salivation. In humans, classical conditioning can explain how certain stimuli, such as a specific place or object, can become associated with anxiety or fear. For example, a person who experiences a panic attack in a crowded place may begin to associate crowded places with feelings of panic, leading to avoidance behavior. This avoidance reinforces the fear, making it more difficult to overcome. 2. Operant conditioning. Operant conditioning, developed by B.F. Skinner, involves learning through the consequences of behavior. In operant conditioning, behaviors are either reinforced or punished, leading to an increase or decrease in the likelihood of the behavior being repeated. Positive reinforcement. The addition of a pleasant stimulus following a behavior, increasing the likelihood of that behavior being repeated. For example, praising a child for completing their homework encourages them to continue doing it. Negative reinforcement. The removal of an unpleasant stimulus following a behavior, which also increases the likelihood of that behavior being repeated. For instance, taking pain medication to relieve a headache reinforces the behavior of taking medication when in pain. Punishment. The addition of an unpleasant stimulus or the removal of a pleasant stimulus following a behavior, decreasing the likelihood of that behavior being repeated. For example, receiving a fine for speeding decreases the likelihood of speeding in the future. 3. Extinction and behavioral experiments. Extinction occurs when a previously reinforced behavior is no longer reinforced, leading to a decrease in that behavior over time. In CBT, behavioral experiments are used to test and modify clients' beliefs and behaviors. By engaging in activities that they would typically avoid due to fear or anxiety, clients can learn that their fears are often unfounded, leading to a reduction in avoidance behavior and the extinction of the conditioned response. Integration of cognitive and behavioral theories in CBT. Cognitive behavioral therapy uniquely integrates cognitive and behavioral theories, creating a comprehensive approach that addresses both thought patterns and behaviors. This integration allows CBT to be highly effective in treating a wide range of psychological issues. 1. The CBT model. The CBT model posits that thoughts, emotions, and behaviors are interconnected and that changes in one domain can lead to changes in the others. For example, modifying a negative thought pattern can lead to changes in emotional responses and behaviors. Similarly, changing a behavior, such as reducing avoidance, can lead to changes in thoughts and emotions. This interconnection is often depicted as a triangle, with thoughts, emotions, and behaviors at each point, influencing one another. This model provides a framework for understanding how problems develop and how they can be addressed in therapy. 2. The process of CBT. The process of CBT typically involves several key steps. Assessment. The therapist and client work together to identify the specific problems and goals for therapy. This includes identifying negative thought patterns, behaviors, and emotions that are contributing to the client's distress. Psychoeducation. The therapist provides information about the cognitive and behavioral models, helping the client understand how their thoughts and behaviors are contributing to their emotional difficulties. Cognitive restructuring. The therapist helps the client identify and challenge distorted thoughts, replacing them with more realistic and balanced thoughts. This process often involves techniques such as Socratic questioning, where the therapist asks the client questions that lead them to critically examine their beliefs. Behavioral interventions. The therapist and client develop and implement strategies to change problematic behaviors. This may involve exposure therapy, where the client gradually confronts feared situations, or behavioral activation, where the client engages in activities that are likely to improve their mood. Homework and practice. CBT emphasizes the importance of practicing new skills and techniques outside of therapy sessions. Clients are often given homework assignments, such as keeping thought records or engaging in behavioral experiments, to reinforce what they have learned in therapy. Review and relapse prevention. As therapy progresses, the therapist and client review the client's progress and develop strategies to maintain the gains made in therapy. This may involve identifying potential triggers for relapse and developing a plan for managing them. 3. The flexibility and adaptability of CBT. One of the strengths of CBT is its flexibility and adaptability. While the core principles of CBT remain consistent, the specific techniques and interventions can be tailored to meet the needs of individual clients. For example, CBT can be adapted for use with children, adolescents, and adults, and it can be applied to a wide range of psychological disorders, including anxiety, depression, PTSD, OCD, and more. In addition to traditional face-to-face therapy, CBT has also been adapted for use in group therapy, online therapy, and self-help formats. This adaptability has contributed to the widespread popularity and success of CBT as a therapeutic approach. Comparison with other therapeutic approaches. While CBT is one of the most widely used and studied forms of therapy, it is not the only approach to psychological treatment. Understanding how CBT compares to other therapeutic approaches can provide a clearer picture of its unique strengths and limitations. 1. Psychoanalytic and psychodynamic therapy. Psychoanalytic and psychodynamic therapies focus on exploring unconscious processes, early childhood experiences, and the influence of past relationships on current behavior. These therapies tend to be longer-term and less structured than CBT, with an emphasis on insight and self-awareness. While CBT is more focused on the present and on practical problem-solving, psychoanalytic therapy delves into the deeper, often unconscious, roots of psychological distress. 2. Humanistic therapy. Humanistic therapies, such as Carl Rogers' person-centered therapy, emphasize the importance of self-actualization, personal growth, and the therapeutic relationship. Humanistic therapists focus on creating a supportive and non-judgmental environment in which clients can explore their feelings and develop a stronger sense of self. While CBT is more structured and directive, humanistic therapy is more client-centered and focuses on the individual's capacity for self-healing. 3. Integrative and eclectic therapy. Many therapists today use an integrative or eclectic approach, drawing on techniques and concepts from multiple therapeutic models, including CBT, psychodynamic therapy, humanistic therapy, and others. This approach allows therapists to tailor their interventions to the specific needs of the client, combining the strengths of different therapeutic models. While CBT has a strong evidence base and is effective for many individuals, it may not be the best fit for everyone. Some clients may benefit more from other therapeutic approaches, depending on their unique needs, preferences, and the nature of their psychological issues.